Good afternoon, everyone. Welcome to the week 6 of 8 weeks on the requirements of participation. And today we'll be talking about compliance and ethics. And the compliance and ethics expectations from the government, just for you to know, the expectations were written in the Federal Register in the year 2000. And the information that I'll be sharing with you, some of that is the same exact information that was in the regulations. And that, but at that time, it was not mandatory, it was suggested. The overarching theme with a compliance program, now, a couple things I want to tell you. The infection prevention week 5 PowerPoint, I revamped it because I put in what you have to train staff on, but I also added, oh, well, what did the ROP expect you to do? So that's just a little bit of housekeeping. When you get that PowerPoint, I have modified it and I refined it. Thank you so much, Shelley. I do appreciate the feedback because, you know, you motivate me to be happy and share. So the infection, and I'm going to try that. Well, let me back up. So therefore, that when you get that information, understand that, hey, you have to train your staff on these components, but you also need to know what the government expects of you with the June 29th, 2022 ROP. And in the infection prevention, some of the highlights that may or may not have been highlighted is that the infection preventionist has to work on staff. They have to attend the QAPI meetings. And if they don't attend, they have to have a representative there that will, you know, present their report. So if you are the infection preventionist for a facility that you are, and what are those reports about? Well, I put in the PowerPoint, you know, the list of items, you know, you're going to talk about surveillance, you're going to talk about tracking and the, you know, root cause analysis and epidemiology, all of those things. The ROP also talks about the criterion for an individual to be an infection preventionist. And it can be an epidemiologist, it can be someone who's a non-nurse, but they would have to have credentials in those areas and a bachelor's degree. And the nurse also has to have, you know, a proof of being a licensed nurse as well. So those slides were added into the infection preventionist as well. And again, there was an administrator, and I promise you I'll reply to you. I told you thousands of emails, and I going through them is hard, but I do get to everyone. If I do not reply to you within a day or a week, I will get back to you. And if it's quick, I might say, hey, don't worry, Sue and Donna will help you with this, or I might have a dialogue with you. But there is one administrator that said, and I agree with him, and I haven't responded yet. He said, Chris, how do you think that we could actually do this? And, you know, I agree with you 100%. I do think it's a daunting, tall order. And that's why I'm trying to help, because I do think that I'm glad that the government is looking at education and training. And I'm going to give you my scenario that we as individuals with technology feel as though, tag, you're it. So I send you the 500 slide PowerPoint on infection prevention. I'm making this up. And I hit send, and let's just say it's 600 slides. Well, if it takes you a minute a slide, right, then that minute a slide would take you 6 hours, right? No, or 10. So let's do the math, right? 60 minutes, 1 hour, 10 hours. So just because I hit send, tag, you're it, doesn't mean that the job got done. And I also I'll tell you something, this idea, I've always done the Freaky Friday, but this is Thoughtful Thursday. But what I have done is I've taken about 204 hours of education, and I'm chunking them into hour segments, which I think is much more palatable for the adult brain. And you hang out, you listen, you learn, and then you're like, oh, okay, because you get a nugget every time, but it's very difficult. Don't misunderstand me. I'm still a big advocate of 3-day trainings and, you know, being with people, but given the staffing crisis, you know, obviously having the ability to learn during the workday and get that information as well. I am an advocate of, I love live because I think that it has I present better when it's live. If I'm recording something, I just don't have that adrenaline, and I fumble. I fumble when weirdly enough. So it has to be live for me. Maybe I'm an adrenaline junkie. I don't know. And I know that more and more people are logging on. So having said that, the essence of today is compliance and ethics. And the overarching themes with compliance and ethics are that I know in 30 seconds if you have or you don't have an effective compliance program. How do I know? I know because that I walk into your facility, I randomly grab someone and say, hi, who's your compliance officer? And if they don't know, then you do not have an effective compliance program. So that's number one. Now, why is this such a big deal? Well, 97% of governmental investigations are won by the government. So only 3% the provider, you, wins. Why? Because if you do not have an effective compliance program, then they have you at hello. They know. And I'm going to show you one of the things they do to find that out. They're going to know it. So a compliance program takes years to build. It's a philosophy. And I had a client in the West Coast, and very, very proactive. And I came out and I trained them. And one of the things that, I don't know if I made it up or we made it up together, but it's doing the right thing when no one's looking. So you're always doing the right thing, and you're creating an environment in which people feel very comfortable going to the leader, going to the compliance officer, and giving feedback on areas of opportunity. The reason, so just because for those of you that are on the call, and I assume that you're pretty intense and you're a detail-oriented individual. So, and you like things to be in order, as do I. But one of the things you need to know is that this is such a complicated industry that not everything will be in order, and there will be errors. But if you have an effective compliance program, that's the same. But if you're doing everything in your effort to identify, mitigate, deter, then if something goes sideways unexpectedly, then you will not be penalized for that, because it could be some cyber attack, that's something that's just way beyond anyone's imaginable ability to understand. So the goal is that you implement an effective compliance program that shows the government that you are attempting, or you have implemented systems that are to identify and detect issues. And so we'll go through those levels, those elements as well. Now, the training of it is interesting, because you have to train individuals in your organization to what compliance is. And this will cover you for that, for sure. It'll get even deeper though, because in the elements of compliance is education. And what I just spoke, like I said, in Illinois. And one of the things that and again, I think as I talk, that education for the last decade has been put, and I'm not going to say on the back burner, but we had this false sense of security and false sense of knowledge that we knew what was going on, because we hit send, and the 500 or 600 page PowerPoint went. But at the end of the day, just because I have it in my inbox doesn't mean I know it or I understand it and I can comprehend it. And therefore, it's all about ensuring that there's an engagement with the learner to have the ability to understand. And the more you learn, I joke, the more you know, the less you know. I'm joking, but I'm not. So we're on week 6, and compliance and compliance and ethics. So, oh, that's great. So there's a little thing in there, but that is this slide has, I don't know, that's in there. 7 elements in an effective compliance program. That slide's wrong, but the objectives are right. 3 reasons to establish them, and what intent of the False Claim Act. So I like you to remember what those are, because those will come up in your questions if you're getting CEUs. So if you're getting CEUs, then you have to fill out a speaker eval, and you have to do the questions. And usually I do about 5 sometimes I do 10, depends on my mood, but you have to give a 70% or better. And that 70% is like, hey, you listened, because no longer are the days for you to be able to show up and, sit in the room and do your emails and get your CEUs. You have to really show that you're learning and engaging. So the tag for training all staff on compliance and ethics is F946. So there are policies and procedures, there are components. You must make sure that you are training everyone on an annual basis. You must have systems, and that's for those with 5 or more facilities. I can say that even if you don't have 5 or more facilities, it's so super prudent to provide the training. Number one, because you want to make sure that everyone understands the jargon and the terminology. Number two, that you have this part of your onboarding. Number three, you're going to develop something, like I said, that California company doing the right thing when no one's looking. Your personality, the personality of the owner, the leader, the corporation has to sort of bleed out of it, because yeah, we've got mounds and mounds of examples of manuals and mission statements, and it has to be definitely customized to you, which once you customize it, then you will understand, like, okay, I get it. Now, I also want to say for those individuals that are, I always say I'm 55, and I say that because I've been around, but also that there's some things I don't know because have not been in the industry as long as other people. But when people first hear of the concept of compliance and ethics, they're just like, give me a break. Like, we get no time for this. I can emphatically tell you that by implementing these processes, it will help you as an organization. And I'll show you how that comes as well. So the key element with this slide is that right now you're getting trained, and the individuals in your organization are getting trained, that there should be an annual training for all individuals and all new hires to what the point is. And in that training, where do they go to provide feedback? And usually there could be a helpline, a hotline, there could be a compliance box, there could be an email, feedback, compliance at Harmony Healthcare, whatever there's an email that's generic and not someone's name. That works too. So general sessions, hotline, a box, and feedback. And the point is that if anything, the importance for that training is to communicate how they can communicate their feedback to you. The surveyors, everyone is looking to see if you have a process in place to track staff participation. That is with all of these trainings. And for example, that if you download it and you have them view it, again, I highly recommend you do things in person. And what I mean in person is not the training, but if someone is onboarding and you're using the video, that they're sitting in it and you have the staff development coordinator, because I do think there's a lot to be lost when someone's doing it by themselves all alone, and to have the interactive questions. And I do think this group is super interactive, which I'm grateful for, because your questions make it great. So what is your process to track? And you can do many, many things. Don't forget, a simple binder, a clipboard, whatever can work. Or you could develop something. I track who comes through, you put your name in and you sign up, and I have a tracking system. And then when you download it, your name goes in. So therefore I can tell the CEU people, okay, who attended, what they are. Okay. So defining staff also is everyone, basically. And staff also includes individuals. And we also defined staff in all of these trainings. This is a common denominator, that it's not just people that are on your payroll. It's people that are consultants, the people that are volunteers, individuals that are, consultants. There are some clients that sent us stuff. And I mean, obviously we watch it and we review it, but we sort of semi-chuckle, because we're like, yeah, we're the ones that are training on it. But still, I think it's great. They are following it to the letter of the law. So who is being trained? So the key area is this. If I'm a surveyor coming in and I am checking to see if any individuals are educated, I want to know where you keep that information. It could be a binder, it could be an Excel spreadsheet, I don't know. But the first thing that I'm going to look for as a surveyor is I'm going to come in to see who you missed. So I'm going to look and cross-reference today's schedule with your whatever form it is. And this is something that, I have a heightened awareness during plan of corrections and training, that you want to make sure that there's some tickler in your system that if you have a new hire, did they complete all of their onboarding? If you have a rehire, if you have an annual, so on an annual basis, okay, did they go through their orientation, et cetera? Excuse me, their annual educational program. The program, okay, with regards to your training program and effectively communicating your standards, policies, and procedures, you have to develop something that is specific to you. And again, that's with your mission statement, your mantra, et cetera. So let's just go a little bit back and go through the historical. Compliance mandates have occurred in the military, they've occurred in banks, and compliance and ethics programs actually were started in, I'm going to say, the 1900s, when a private citizen was selling arms, guns to the government. And there was the ability to provide the wrong machinery or the weaponry. And just so you know, because you bill Medicare Part A and Medicaid, because Medicaid, even though it's state funded, there is state directed, has federal components to it. Because you do business with the government, meaning you bill Medicare, Medicaid, you have to fall under these criterion. And if you do something that is not representative, like this machinery or weaponry, it would be called a false claim. And that 97% of successes of the government, usually the determination is that there's a false claim. So let me give you an example. If you fill out a UBO4 and that UBO4 says that they were, I'm going to use old school, RUX, and the MDS said RUC, there was not a triple check to ensure that the MDS correlated to the UBO4. The government would perceive that as a false claim. And you may say, oh, well, I didn't know, it was a glitch or we dismissed it. No, it's a false claim. Not only will the money be taken back, you will also be fined up to $5,000 per claim. And per claim means that it would be 30-day, 60-day, 90-day, whatever, that. So for those of you logging on, I did start a little early. This will not happen again. I'm so sorry for the time screw up, but I am in Illinois. Okay. So I've been doing chit chat kitty cat to make sure that you didn't miss anything. So I'm going to start here, 7 elements: policies and procedures, reporting and investigating, education and training, prevention and response, auditing and monitoring, responsibility, oversight, committee, enforcement, discipline, incentives. Good. Number 1, policies and procedures. Now, each one of these sections is a 3-hour course. It sounds crazy, but it is. Now, but policies and procedures, the nugget I'm giving you is that the number 1 most important policy and procedure is a non-retaliatory policy and procedure. That means if you come to me and you tell me something that's going on in your organization, I will not fire you. I will not retaliate. I will not be, because you're bringing something to the awareness of the senior management team. You're not going to be penalized for your openness and your feedback. So, and by the way, I may have mentioned this before. This is specifically referenced in the ROP of June 29th, 2022. That exact example. I have been preaching on it for 7 years, that particular comment. So, number 2, reporting and investigating. Any of you on the call, the most important thing to do when it comes to your reaction to, and I'll give you a true example, is you say, so now the complaint comes to you and you're like, thank you so much. I appreciate the fact that you're giving me this feedback. And I'm so glad that you're coming to me and you're not going to the government. So a complaint is a gift. And the person comes to you, now you must follow up and say, and I'm going to do an investigation. And I'm going to let you know the results of that investigation. So, it may take me a week, it might take me 3 weeks. I don't know yet, but I appreciate it. So the example that I'm going to give you is and by the way, that investigation that you do can be done in multiple manners, but I'm going to give you one example. The administrator in a state calls me up. He's also an attorney, and he's the owner. And he said, Chris, I received today a complaint from my MDS coordinator. And the complaint is that therapy is giving way too many minutes to the patients. And I said, okay, Mr. Owner, Administrator, Attorney, what would you like me to do, sir? He said, Chris, I would like you to do an independent investigation. And I said, yes, sir. And I said, and we're going to put it under client-attorney privilege, correct? Yes, sir. And the reason we put it under client-attorney privilege is because we want that to be non-discoverable and we want it to be private. His reaction to the person with the feedback was, thank you so much, and I'll get back to you. Now, one of two things is happening or happened. Number one, therapy was giving too many minutes to the patients. Number two, the MDS person maybe didn't understand the rationale for therapy, and maybe they required education, training, and understanding what the skills, knowledge, and judgment of therapists are required for under the Medicare program. Now, the result of that investigation, I'm not going to tell you, because why? Because I want you to and put in your brain that the important piece here is that you, or the leader, whoever has the complaint, toggles and says, thank you so much. We will do an investigation. The best thing that you can do is an investigation. I know there's tons more people logging on. Don't worry, you're going to hear it all. I promise. I did have a little snafu with the time today, but we're going to be fine. So we're just starting the 7 elements. The first one's policy and procedure. And most important thing is the non-retaliatory. Reporting and investigation is that when someone comes to you with a complaint, you immediately want to thank them, smile, and say, I'm going to look into that and I'm going to get back to you. So listen, conflict is conflict. It happens all the time. As Oprah Winfrey says, conflict is a product of miscommunication, which is very easy for people to miscommunicate in a very busy industry. So the key is that you as the leader are going to respond, address, and find the information out. Now, number 3 is education and training. The mere fact that you're sitting, listening to this is wonderful because you're learning and you're educating and you're understanding all the components. To really understand compliance, it is when I tell you, a minimum of a 3-day program, and it's a lot because you can go in different avenues. But I think the essence of the education and training is, okay, you want to, on an ongoing basis, provide individuals with, okay, what is PHI? What is HIPAA? What are the things what is the False Claims Act? Educate and train. And the government really likes to see, initiatives and slogans and crossword puzzles. And I don't mean them with crossword puzzles, but that you are putting a concerted effort into giving the tools to all the individuals within the organization. So, and the education and training it's not necessarily stagnant because things do change, especially in this industry. So that you have a competency, that people understand it. For example, PHI would be the best one. And understanding that, okay, you're at dinner with your friends and they start talking about some medical thing. And then they say, well, I can't share that with you because of PHI. No, that's really not the case here because it's privacy, it's your own privacy, but it's not because of PHI. And PHI is, when you transmit information about a provider, a patient, and obviously you have an allowance to do it if it's for billing, if it's for legal, right? Or if it's for the care. So there's an allowable transmission of data, but on other instances, there are not. And that's what they're trying to prevent. So teaching and training is super important. So prevention and response. So when you think about your compliance program, and by the way, I do not judge, because I estimate that probably at least 50 to 70% of you don't have one. And I wouldn't blame you, because you have not had the time. You have gone through the worst couple of years of the industry. And as I said earlier to the people in Illinois, you are not in PTSD, you are in trauma, because you're still having COVID patients come in. So you're all in trauma and you have to take care of each other. So the whole overarching theme is that you're rolling out a program that you are able to identify, detect, and deter for things to go sideways. That doesn't mean you're going to be perfect. It means that you have a concerted effort in your organization to fix it, find it, and identify it. And when you identify it, by the way, when you identify it, I want you to think of the nurse in the battlefield. And all of a sudden, in the battlefield, someone loses a limb. What is the first thing the nurse will do? She will tourniquet the leg to stop the bleeding, or the arm, whatever it is. Stop the bleeding. You remember this, because if you have a breach, your number one goal is to prevent it from happening from the time you identify it moving forward. Yes, we can go back, but right now. So, and that's the first thing the government will look at. What did you do to fix it? Okay, in order to prevent this from happening again, this is what we did. The retro stuff we can handle. First, stop the bleeding. Auditing and monitoring. I'm going to give you some things when I tell you, and I've said, this took me 6 months to find my way, my words. I'm going to tell you something right now that took me 6 years to find, through studying, working with lawyers, going to classes, and it's a lot. It's a lot of information. Auditing and monitoring are two separate, different things. You ready? Auditing means that it's statistically valid. And by the way, what is statistically valid? Now, I took statistics, which was a great class, loved it. And like they hyper-focused on, did you label the x-axis? Did you label the y? But what is statistically valid? Well, it varies. And there's a thing called rat stats. And rat stats, so you, me, everyone could inadvertently do an audit, and we could inadvertently have it be statistically valid. You got that? Monitoring is, hey, I'm coming in, I'm looking at your stuff, make sure it go. That's what we do on a monthly basis. We really monitor. If it's statistically valid, you need to do it under client-attorney privilege. Let me say this a different way. So I've been involved in multiple cases, and I've been in the 3% of the winners, because there's a way to win. And plus I'm competitive too. So like, you know how that goes. All right. So if I am doing an audit on my completion dates of a certification form and the timeliness, and I'm going to look at every record, that is statistically valid. And that's not something you want flying around the internet, because you're going to have enough to worry about that you're just going to hand it, right? So you're going to make sure that when you're doing an audit and it's under client-attorney privilege, that you are managing the information so that it's not. I've seen clients, old, new, past, present, that have basically sunk themselves because of their regional team doing reports, and those reports were discoverable, so that it actually hurt them on the investigation. We at Harmony are very mindful of how we write and word things. Let me give you a great example. I'm looking at the medical record. There's no certification form. Am I going to write that unable to locate, or am I going to write not completed? The average person would immediately write not completed, but do you really know that it wasn't completed? And it's too late if you wrote not completed, and then the feds are looking at it. So you have to be very careful how you choose your words. And again, it's not because it wasn't incomplete. Maybe the person just could not find it. So, and number two, when you do an audit and it is under client attorney privilege, make sure that that client attorney privilege is true, a veritable client attorney privilege. And what I mean by that is, oh, I sent the report to the attorney and 25 other people. That will be dismissed. It won't be under, you have to go through the attorney. And I typically will do it with one other individual in the organization, because they, whoever that is, might be the executive director, to preserve client attorney privilege and be sure that every single email that you write says client attorney privilege, because when there is a subpoena of correspondence and then they can just get the information, it's extremely difficult to vet out what was client attorney privilege or not, unless you can tell the IT company client attorney privilege was on the subject line. I put client attorney privilege on the contract. I put client attorney privilege on the subject line. I put it on the invoice. Any discussion about this particular engagement is under client attorney, and within the organization. So the next one is responsibility oversight. Now, and again, each of these are a 3-hour session. It is what it is, because you can get into these different rabbit holes of, well, what if I have multiple buildings and how do I do it? But the key element that I want to tell you on the oversight of a compliance officer is, who is your compliance officer and who do they report to? So let me just give you the quick elevator. They call it elevator pitch, 30 seconds. If the compliance officer does not report to the top of the food chain, they have you at hello. So let me give you an example. If I'm the compliance officer, I report to the administrator. The administrator reports to the board of directors. Well, how do I communicate that I think the administrator is doing something if I don't have access to that board of directors? So the reason I say that to you is because if I'm going into a 6-year OIG DOJ investigation and they ask you for your org structure, they had you at hello. They knew you didn't have an effective compliance program because you did not have an individual that reported to the top. And this puppy is going to drag out 5-6 years with millions of dollars in settlements. So why? Because of that one individual. And this individual cannot have direct reports unless they are other compliance officers and you're in a multi-facility organization. So out of the chute, they have you at hello and they're like, we got them, and it's going to go on and on. Now, why do you want an effective compliance program? You want an effective compliance program because if and when, and they will go sideways, that you're not put under a corporate integrity agreement. In other words, like, hey, listen, this organization has tried their best. They have systems. They have a reporting structure. They have the 7 elements. This is just let's just say it's some cybersecurity thing that occurs. We're not putting them under a corporate integrity agreement. They have practices, policies, procedures in place to review their records on a monthly basis, to, look at their cross-referencing their UBO4s with the actual support. They have people looking at their medical records. Now, by the way, compliance can cover any span, quality of care, but 80-20% principle, most of them are billing, and they're going to get you on the submitting a UBO4 that has misinformation on it. So the last one is enforcement, discipline, and incentives. The key element to know on number 7 is that if you have rules of enforcement, let's just say Mrs. Jones, sorry, forget that, scratch that. Are no cell phones allowed in patient room areas. Now, this could be an older type of policy because now that patients are being admitted and they have iPhones and Facebook, and it might say this is a decade ago. So let's just say that I am not allowed to have a tablet, a laptop, or anything in a patient room. Let's just do cell phone. So I have my cell phone. And why are they not allowed? Because of taking of pictures and defying the Privacy Act, defining protected health information. But then a doctor comes in and he's the orthopedic surgeon for 50% of your patients, and he is using his cell phone, and you then allow it. So, the example would be that if you're going to enforce something, you need to have consistency in how you enforce the rules. And with technology, which is always ever fast changing, that certain things may or may not. For example, Alexa, right? Alexa, who I had them, and within 30 days I dumped them because I consider it a possible privacy breach that you can hear and they record everything that's being said. We'll go there another time. Okay, so now the 1860s. So it's not new, and it was to prevent profiteers from selling bogus goods to the Union Army. I want to say this to you because I don't want you to think this is a new concept. And it's something that most entities that work with the government have to have implemented. Hospitals have had it, pharmacy companies have had it for decades. And it may be, when I say, yeah, probably decades. And but again, it just was never mandated up until phase 3 of the ROP. And the False Claims Act is the number one mechanism for someone to fine or charge someone with noncompliance. And again, it's the UBO4 is not reflective of the services that were rendered. And the other part too that I have to say is that I told you earlier that, in the year 2000, those 7 elements were written in the Federal Register. Let me say that again. In the year 2000, it has been 22 years and it's now being rolled out. Don't be that surprised, because I believe that a lot of things are put into the regulations, and it's sort of the natural progression of information that the Health Insurance Portability and Accountability Act came into the regs in 1996, right? And a lot of individuals, it took them until 2006, 2016, that's 20 years later, to roll them out, meaning you can't talk about the patient in your organization. Like, again, you might have noted it with famous people, but I'll give you a great example. It was in the Northeast. I was doing a 3-day compliance, and one of the nurses said to me, Chris, I have to tell you the story. Yes, tell me a story. And he says, I had a patient in the ICU, and the patient had a family. They weren't famous, but they were in my community. I went to the store on a Saturday, and the brother of the patient said, hey, is Jack and then the nurse says, yeah, oh my God, blah, 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 and starts talking about him. The nurse went back to work on Monday, and the patient said to the nurse, did you happen to mention to my brother that I was here? And he's like, oh, yes, I did. And he's like, well, the last time I saw him, he had a gun to my head and my wife's head. The nurse was like, no, meaning that here he is innocently and ignorantly giving the information. But at the end of the day, the patient said, listen, I am not going to report it because you told me the truth. It was a total innocent mistake. And I told the nurse, I'm like, can I use that? And he's like, yes, absolutely. But the information is that you cannot share that someone has been, in the hospital or in that information. So long and the short of it is, it's about, but HIPAA, which is 2 A's, not 2 P's, not hippopotamus, is about the portability of information. Now watch, if I fax information, it cannot be intercepted, but if I email it, it can. So for me, everyone knows I have a fax machine locked behind a lock behind a lock, right? So if people want to send me like documents, I'm like, send it to the secure fax. But give me a second. I'm losing. Okay. Now the point is that if you say, okay, Chris from Harmony has a left side appendectomy, blah, 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 and you send it over the line, it could technically be intercepted. Now, why do you think that the government doesn't want it to be sent over the line? You think it's for privacy, but actually that's not it is, but it isn't. So in other words, one of the reasons is because one of the biggest fraudulent activities is taking people's insurance numbers and falsely billing to retain that information. So it's not that people care that Chris has, a right foot pins in her foot or an appendectomy. It's really about, can we get her Medicare number, and then can we falsely bill it? So yes, my privacy matters, but at the end of the day, really, does this generation of my kids care? They're on TikTok and Twitter with their what do you got, their wisdom teeth out. They don't care about privacy. I'm joking, but I'm not. So the reason for this protection is to prevent unnecessary spending on false. Terry, yes, this recording will be available. It'll be on YouTube. Okay, so then you have to know the entities, right? You have HHS, that's a Health and Human Services, the DOJ, which is the Department of Justice, and then Department of Labor, that's the DOL, and this program for HIPAA, okay, has federal agencies that will have oversight. And back to this historical component, that these entities are put in place to combat fraudulent claims and abusive practices of healthcare providers. Now, like I said, that you could have, instances in which someone billed for certain items that were never rendered, or they billed multiple times. All different iterations can occur. Now, what's not listed here is OIG, which is the Office of Inspector General. And the OIG has probably multiple, but two arms that you would be familiar with. One is the investigative side, and the other one is the corporate integrity. So the people that investigate it and find out what's going sideways, if you're in that case, those individuals won't be the people that help you through your corporate integrity program. A corporate integrity program is usually 5 years, and it means that things went sideways, and now they want to just be involved for 5 years to make sure that it doesn't happen again, and that you do know how to put in one of these programs. So the key, you will be familiar with these. Now, I am a therapist by background, and I was trained by the best. I told you, Hillhaven nurses, they were the best. And I was lucky because I had that foundational training, and I can see things going sideways if someone doesn't know how to train or where to get the information. Now, give me a second. I lost my train of thought. Program directors, federal agencies, OIG. Okay, so those individuals are going to come in this side and say, hey, we're going to help you out. We're going to make sure that you're doing things right, and we're going to do an annual audit, and so, etc. Now, a huge portion of investigations are triggered by whistleblowers. And a whistleblower is an individual that technically or typically works for the organization, and they're saying, hey, this looks wrong. But I want you to know that these whistleblowers are incentivized because they will get 12% of whatever the finding. And I, as a healthcare consulting firm, have, strict guidelines that as a consultant, we are not whistleblowers, and that if any of our employees identify something, they have to, by contract, come to me. I then will go to the owner, because I think that, in other words, you need to give, first of all, we are not the ones that identify fraud, the F word. We don't even say it. That is not our role. We are to do our audits and find the information and bring it to the lawyers, bring it to the senior managers for them to make that decision. So if you have consultants coming in, they're saying, oh, that's like, the word itself is very, how do I say this? It's contentious. And the second thing I want to tell you is that I've seen a lot of false allegations on fraud because people don't know the rules. And if they don't know the rules, it's much easier to say that's fraudulent than it is, let me investigate it, learn it, and see what's right. And the other thing is people are all motivated and driven by money. So they might say, hey, maybe I have a case here to get this 12%. That is not, I am not that type of person. I want to help people fix it and identify it, because education and training is usually a huge area that is lapsing because people don't know. You'll have much better operations if you educate and provide people with the tools to be successful. And the example I always give you is the CFO says, well, if we train all these people, look at it's going to cost us. And what if they leave? And then the CEO says, what if we don't train them and they stay? Knowledge is a gift, and knowledge is empowering people to make the best decisions on behalf. So the point of this slide is that there are multiple federal and state agencies that get involved if things go sideways. Things can and will go sideways. The goal is that you identify them immediately and you rectify them as soon as possible. And that you again, you sort of have this, all of you have this skill set. The surveyors come in, my seat, I'm not in my house, I'm in the hotel. My seat is making sounds. It's not me. It's just creaking a little bit. So where were we now? Because my creaking, that's my ADHD kicking in. It's the end of the day. You have these different entities that are going to work with you, and they want to see that you have the essence of a compliance program, that you are reporting, you identify, you educate, and you give people the tools to be successful. So I do have more to say on that as well. And then the AOIG, right? And that's what I mentioned earlier. They give you the two wings of it, and they're coming in because things aren't doing it. But you absolutely can have errors, and you can just not know that you're doing it. These are some OIG findings, but I want you to know that one of the big ones that I bring up is recently in 2022, and it's which Medicare Part C is managed Medicare. And that means that you have your traditional Medicare, but a contractor comes in and they're going to manage it. And the goal of that contractor managing it is to save the government money. And this recent OIG audit found that 13 to 18% of managed Medicare cases were denying coverage. Because remember, managed Medicare cannot change the rules of coverage criterion. If 26% of total caloric intake and 501 milliliters or more are consumed via G-tube, that is skilled. There is no ifs, ands, buts about it. The managed Medicare cannot say, oh, we're going to take them off skilled, because no. They have to follow them. So if you say 13 to 18%, I bring this to your attention because, let's see, 17,000 different reasons, but I bring this to your attention because if you have managed Medicare, you see the average clinician, it's called regression to the mean. So if you have a managed Medicare company giving you rules and you have therapists, nurses treating, they all are going to come up with some average type of consistent approach to everyone, which may not be in the best interest of those traditional Medicare Part A patients. But it's ethically, it's very difficult for a clinician to say, well, hey, you've got, premium plus insurance, so you get 900 minutes, and you've got no insurance, so I'm not going to give you it all. It's very difficult for a healthcare person to do that. And it's something that needs to be addressed, but we'll go there. All right, very good. So these are some examples, which I probably will take out and I won't give them to you, because it's just examples of, millions of dollars that happens when clinical healthcare professionals make mistakes. They're in there just to say that it happens all the time. I'm very blessed that we work with attorneys across the country. And there is a phenomenal attorney down in Florida. He does do work in Boston too. His name's Gabe Imparato. And, he just, again, this is a specialty for people that get involved in this type of thing. And I've heard examples of cases in which, related party or the Stark laws, all those things can impact an individual. And some people, when I tell you, they get fined and they had no idea what they were doing. And there's a case in which a home care company, the competitor, filed a complaint alleging that the healthcare provider had broke the Stark laws with the anti-referral because her husband was a surgeon or a physician. But really and truly, he was like when I tell you 6% of her home care patients, but she still got fined. And I'm giving you sort of different numbers, but you have to be mindful of that. So the Affordable Care Act, Secretary of Health and Human Services, OIG, the core elements, and those core elements are the ones that I reviewed with you as well. So obviously, one fun fact is data is interesting because data can help maybe identify a potential area. So let's talk about the Pepper report for a second. The Pepper report giveth and taketh. And when the Pepper report came out, and remember when the percentage of RU days, now follow me this, just because you're above the national average or the national percentile ranking does not mean that you are fraudulent. But what it would mean is that you probably would be at higher risk for someone to look at your information. So remember, an average, hey, I got a 96%. That was my average. A percentile means that if your son or daughter took their college entry exams and they were in the 91st percentile, that means that they had a grade better than 91% of all the students that took the exam. That is a 91st percentile. The Pepper report does an 80-20, 80%, right? If you're below the 20 or above the 80, they will look at you. So your data will be one of the many reasons why someone may look at you. Miami-Dade County is historically known for having the highest fraud. Sorry, Miami, I'm not saying you're bad. I'm just saying that one of the things, if you look at, there was a report done in 2012 that the average patient on Medicare Part B received, say, $3,000 or $6,000 of Part B, whereas the national average was like $1,500. So don't be falsely secure. They have data, they love their numbers, they love to compare. And that's where you might have TPE or an ADR or some inquiry to look at more records to see what's going on. And so now I'm not going to get into this 2012 because I actually almost wrote a letter to the New York Times, and Thomas Burton was the author of it. And I believe it was a misrepresentation that 25% of SNF claims were in error, because it could have been that okay, we can go here for a second, that the MDSs weren't accurate or whatever, but I don't believe this is true. But this is what an OIG report comes out. And it's also something very important for those that are compliance officers. You want to look at the OIG reports because it's going to give you a heads up on what you should be looking at. Let me say this a different way, compliance officers. Every year you have to do a compliance plan. And in that plan, you're going to list all the areas that you think expose the building and put them at risk. Then you have to prioritize them. And by the way, the best laid plans, let's just say in 2019, you wrote your plan and then bam, 2020 hits and COVID hits. Everything you wrote is out the door because right now your compliance is focusing on infection control, right? I'm saying that loosely, but best laid plans, you have to be nimble. So the key element here is that the OIG report exists and you want to see what is the top items. Thomas Burton wrote more intensive services were done than actually performed. Patients could not benefit from it. Now I can go on this, and this is where I talk now, compliance. Every one of you, if you're concerned about compliance, the number one thing you should do is look at the minutes of therapy that have been rendered this year. How do they compare to 2018? Because PDPM went into effect in October 1st, 2019. Do not let the reimbursement tail wag the dog. If I'm the government, I'm going to look, I'm going to give you a pass for 2019 and 2020 because of the pandemic and 21. But in 2022, I'm saying, what's going on here? You see, you need the therapists. And I think that if you have to look at your contractual arrangements. So, okay, I have 5 things to tell you. Number one, 720 minutes is not a lot of minutes. FYI, it's simply not. If you think it is, then we can have a separate conversation, but it's PT and OT 5 days a week, not even speech, 72 minutes. These patients should be receiving therapy 7 days a week. What else are they doing in this facility? Okay. Number 2, if you were given the 720 minutes before PDPM, why aren't you getting them now? Why? And number three, you have staffing crisis nationally. If you have a staffing crisis, then the more hands on deck, the better care you'll give. So take a really good look at your contractual obligations, whether you're in-house, and again, it's irrelevant to Harmony if you're in-house or you're out-house, meaning contract labor. But are you getting billed by the minute, or are you getting billed by the PDPM rate? If you're getting billed by the PDPM rate, is there a stipulation in there that they have to have rendered care to the patient? If you're paying a therapy provider a percent of a rate and they don't have any obligation to provide services, that's where the government would have issue. You have to make sure that your vendor contracts, whatever you want, partners, whatever you want to call them, that within those arrangements, there is nothing inside that could be, there is everything in those arrangements is with the intention that you do things correctly. So I would look at a contract, all of your vendor contracts, to make sure that there's nothing in there that hurts the essence and the spirit of compliance. So, and in this 2012 investigation, in my opinion, the again, more intensive service were done than actually performed. Well, that's a different story. If you're saying that, hey, they put in 720 minutes, but they didn't give them, that is fraud. But if they're saying that more intensive services were done than were needed, that's when we get into the conversation of, okay, is 720 minutes a lot or a little? Because you perceive 720 minutes a lot, that is a clinical discussion. So key areas there. And, it's showing you that 26%, basically that number, that things are billed in error. Now, for example, for you to run an effective nursing home, you'll always hear me say, fill the beds, collect your money, give good care. And for whatever reason this year, and maybe the last 3 years, we've done a ton of billing office support. And maybe you've lost a billing office, I don't know. But if you don't have a good billing office, then you're going to have more woes with receivables. And because if that first claim isn't done correctly, so I mean, I believe there are a lot of errors if people are not educated in what they're doing, but for some reason right now, there's a massive issue with billing office and finding the right people, and there are errors, and it's just adding to the burden of the industry of receivables. So keep a good eye on that. And so if there's a 25% error rate, well, the statistic is a statistic, and let's just say they're half right and it's 12.5%. Knowing that if 10% of your information is billed incorrectly, you're going to want to take a good look at that. So all these things happen. This was with CODA, the change of therapy, not CODA, the assistant, and that the reviews. Now let's talk about this. Right now, I would bet that 50% of you have what I call a TPE. That's a targeted probe in education. And that is also falls under the umbrella of compliance, because what the government is doing is saying, give me 20 of your records and I'm going to look at 20. And if you have a 15% error rate or greater, I'm going to go to round 2. And if you have a 15% error rate, I'm going to go to round 3. I'm also going to educate you in between, and I'm going to educate you and give you time to fix your systems. Fair enough, but they're still denying the money. And if you appeal it, it doesn't impact your error rate. So now, we do a ton of these for clients, and we prep them, we review the records, we do a letter, etc. It's a great way to see if you have systematic issues. But on the other hand, it's also, in my opinion, again, I am anti-litigious. I hate lawsuits. I'm a Capricorn. I just want to get the job done. I'm just, want to live my life and do my day-to-day. But when you're under a review, what happens? And that's not a lawsuit, but a review or a TPE means that you have to expend energy on something other than your day-to-day. And something's going to get lost. Something's going to suffer. Something in the day-to-day practice. So what happens is that when you're prepping this information, number one, everyone should know about it. Number two, you should be timely. Some of them may be prepay, some of them may be post-pay. I can tell you this much: if you don't respond, which has happened because they're in your DDE system, your common work and file, You may get a letter, or you may have it just inform you on the system. So if your billing office manager does not see it and doesn't tell you, months will go by and all of a sudden you're going to get this notice that says, yep, we're taking the money. And you're like, whoa, what do you mean you're taking the money? Now I immediately rebuke it. Say, no, slow down. Because I'll get these letters from clients like, Chris, we missed it. I'm like, okay, we're going to fix this. And you have to appeal it. You have 120 days to appeal it. They have 60 days to tell you what the results are. And there are 5 levels of appeal. I'll make that another session for you guys. But the point is that understand that they're going to be the amount of auditing and monitoring from the government on you is ongoing. You might have peaks and valleys, of this that coming at you, like what's going on, what, and we'll see phases, for lack of a better word. But it's a fiscal intermediary, a MAC, a governmental contractor that's being paid to review and find dollars that are fraudulent. For example, if any of you are old enough to remember the DAVE program, that DAVE program to help and educate. Well, I've known people that went through the 2.5-week training and they're like, it's to uncover fraud. So, et cetera, et cetera. Now, a couple of things. When I was first into the industry, which is 32 years ago, when we were trained on fraud, you had to have the intention to fraud. Now, somewhere along the line that changed. And this is the important, slide 37 is super important. If you didn't know that on October 1st, 2011, you have to do a COT, a change of therapy, on any patient that has stopped therapy, and you went 3 years and you billed an extra $2 million, you're culpable. And if you had deliberate ignorance or it's reckless disregard, it doesn't mean that you don't have a free pass. And the reason that I say that is because it's not in there. Here it is. If you have a false claim, so the example is I complete a UB04, I submit it to the government. I was in RUX, they're really in RUC. So let's just say the difference in payment for the month was $3,000. Not only are you going to give back that $3,000, they're going to charge you $5,000 to $11,000 per claim. Let me do that again. They can do upwards of 3x, 3 times. So meaning that, so you did this for their 5-day, 14, 30, 60, 90. That's 5 claims. So 5 times, let's do easy math, 10, which is 50 times 3 is 150,000. So this is where it gets very costly. And so, yes, the goal is that you implement the program to give the best quality care and to prevent, detect, deter any non-compliant mechanisms within your organization. The other key element, though, is that, yes, you want it for that, but you also want to be financially viable. And with these types of penalties, you wouldn't make it. And so those are some things there. So now I'm going to go for another 5 minutes. I have no idea, for those that came on late, I'm so sorry that I was late. I'm going to go 5 more minutes. The compliance, you're going to prevent it, you're going to detect it, you're going to collaborate, enforce it, deter it. So it's an ongoing process. I think a lot of these I've already said. You have ethics and compliance are 2 different things, by the way. Ethics and compliance. Ethics courses. Did you know that 91% of high school students lie to their parents? Who knew? So it's mind-blowing. Ethical, doing the right thing. Compliance is I'm setting up structures and an infrastructure to ensure that we're doing the right thing. So who needs compliance? All of these entities, home health agencies, banks, ambulances, every single healthcare organization requires them. And then a whistleblower, that means someone raises their hand. And by the way, one of the things I've asked is, can a whistleblower be valid if they did not give the feedback? Like, I'm thinking that they should have the opportunity, or the provider should have the opportunity to hear it and fix it before they have the right to go and to the government. And I don't know where that, I know that right now that's not where it stands, but I do think that that is something that should be looked at in every organization, that you need to come to me first but I don't know if it can be actually implemented. I'm not sure. So let's see. Ongoing training, we have to do an annual compliance assessment, and that's almost the SWOT, strength, weaknesses, opportunities, threat, just like you do in your facility assessment, correct? And the early detection, I talked about the CIA, corporate and tech, etc. And so some of these slides we've already did. Now, one of the most important slides, and this is my last 3 minutes. Again, I got away with the time. I'm a firm believer that you have a mechanism of auditing and monitoring. And I'm going to use the term monitoring. Now, remember this, that you have 120 days to correct an MDS. You have 1 year to correct a UBO4. After a year, you cannot go back and you cannot bill it. Now, if 120 days, that's 4 months. So that individuals that have some mechanism of auditing, that's only once a year, once a quarter, it doesn't cut it. Because if you want to be proactive, you want someone in there every month, whether it's internal or external, because that way they can identify it and fix it before it becomes a monetary loss. So anyways, those are the, I'm not going to go through that. I'm going to just basically, because I'm going to edit this for you for your download, but I want you to know that this PowerPoint will be edited for you guys to have. I'm going to stop. And for those that want to use, you have to do the exam and the speaker eval. I'm going to stop the recording for questions because I don't put them, even though I probably should, but I just think they could go off tangent. So I'm stopping the recording. Yeah.